So here we have the spine in its entirety, and you can see all of the discs that are the shock absorbers that are between the vertebra. So when the person moves, flexes, extends, laterally bends, and rotates, everything glides around the disc. And if the disc is healthy, a person can move well and not have a lot of pain. Over time, the disc does get degenerative and injured, and it can start to look like this. When it looks like this, that's when we do not have the shock absorption and we have a difficult time moving and chronic pain ensues. This is the Leander table, and it's a flexion distraction table, and as you can see, what I'm doing right now is stretching the patient. The table is moving up and down, and I'm adding extra pressure. So it's like traction plus trigger point massage on some level, and the patient is experiencing a release, if you will, of the muscles, the tendons, the ligaments, and the discs are actually being pumped.
Okay, now we are on a different type of table, like the Leander that we just were at. This is called a Cox table. And like the Leander, it has the flexion and extension component of flexing the spine, but it also introduces a new component, the circumduction component, which also helps to increase all ranges of motion within the spine, particularly the lumbar spine in this case. With circumduction, we are introducing range of motion that may have been lost, in addition to the flexion distraction. And I find that when we do this, it actually helps to loosen the ligaments and the joints, as well as hydrating the discs. And with this type of maneuver, it really helps with the diversified type of adjusting, which I will do next.